on what the experts have presented to the task force and what we have been looking at, it is quite unusual in this particular COVID-19 experience compared to a normal influenza season where many children will get infected. In this particular experience so far, unusually, fewer children have been infected. What is not clear is whether it's fewer because their symptoms are so mild that we are not picking them up, or whether it's because somehow this is different from the normal influenza and the children are not as prone to being infected for some reason, which we don't quite understand yet. If it is the first reason, that they are in fact infected but very mild, then we have reason to be concerned because they may be infected, and then when they go home and they infect their parents and the grandparents, and these are the people who are more vulnerable, then it will be an issue. If it is a second scenario, then school closures are really not the right measure to put in place because they are not infected. Right? The rate of infection among children is very low. So we are still studying the evidence and we are still looking at the data. And we, as I said, all our measures will have to be guided by data and scientific evidence, and we are going on the advice of experts on this particular matter. So we won't rule it out, but we do need to get better clarity on the effectiveness of school closures and how this can potentially help to break or slow down the transmission chain before we decide on putting in place a measure like that.
At this point in time, most of the modeling studies or recommendations for school closures are in relation to our experience with influenza, where in an influenza outbreak, which it affects both the young and the old, school closures may have some benefit as part of a broader strategy of managing an outbreak to curtail that spread of infection from one person to another. However, even in the experience with influenza, when you do it, how long you do it are important considerations. If you do it only for a short period of time, at the wrong time, when there's still a lot of infections occurring in the community, when children come back into circulation, back into the schools, when schools reopen, in fact, you may still see a rebound and, in fact, high numbers of infected cases occurring. But if you, in that scenario, start off with a school closure, but keep a school closure for a sufficiently long duration until that epidemic peak has passed, and you've now safely protected a group of people but prevented and disrupted that chain of transmission, then there may be, in fact, a benefit in lowering the numbers of people who are infected. But the experience is mainly in influenza. We have very little experience at this point in time in terms of its benefit for infections like COVID. We know that countries have started it, but for example, even in China, it's always been together with other social separation strategies. And indeed, how much of it is due to school closure versus how much of it is in fact due to other social separation strategies is not quite clear at this point in time. And therefore, we are a little bit more cautious about making a decision about when or whether we should close schools. But if we assess the data, the evidence, and we think that there would be benefit, it remains an option for us to consider in the future.